Hi, I'm Haley Perkins.
And I'm Brittany de Oliveira.
And welcome to
Brain Bursts!
So the point of this game is going to be to test your knowledge on different mental disorders, and it's really good for the previous stuff that we just learned in pharmacotherapy and to get you ready for any exam that you're going to have because you're basically able to test your classmate.
Okay, so in order to get things started, it is a two-player game, and what we're going to do is first pick a peg and place it in start. So each player is going to have a different color peg, and they're each going to start at the start on each side. In order to start the game and decide who goes first, we're going to roll a dice, and then whoever got the higher one is going to be the one that first will pick their topic. So say that I got the higher dice roll. I would go and pick my topic and hand it over to Haley.
And the opponent will put it in the card reader, which makes it then, at first it's not visible to see, and then the card reader enables it to see the choices. So then I will be testing her on these choices.
So she's going to read to me my topic that I chose, and she's going to start a timer for 30 seconds, and I have 30 seconds to name the first 5 things that come to my mind with that topic. There may be more than 5 answer choices, but you can only get 5 maximum because you're going to move that amount of spaces with your peg on the board.
But for example, you could get less than that. So if I only was able to recall 3 of the target choices that are listed here out of the 5 to 10 that there are, I can only then move my peg 3 places.
So after my turn has been completed and my timer goes off, we see how many that I've gotten, and she reads to me the answers that I got correct and the answers that I got incorrect so that I know what I missed. Then it will be Haley's turn. So Haley will hand me the card reader. She'll pick her topic, and I'll read it to her, and the cycle will continue. I put it in, start the timer, and we go back and forth. So the object of the game is to get your peg to the end of your board. So you'll go all the way down and back here and end here. So the first person to get
to the finish line
is the winner.
So now we are going to do an example round of the game.
All right, so let's get started. You're going down.
Who's the smartest one here on mental disorders?
Okay, so I'll roll. So I got a 2. 6. Okay, so you go first.
I'm going first.
All right. Go ahead and pick your card. All right. So your topic is going to be name 5 SSRI generic names. So I'm putting it in the card reader, and
how much time do I get?
You get 30 seconds, so I'll let you know when to start. All right, so ready, set, go.
Okay. Paroxetine, fluoxetine, sertraline, escitalopram, citalopram.
Okay, you got 5, so you got the maximum.
Oh, okay.
Do you want to keep going, just for your knowledge?
I think, did I already say fluoxetine? I did.
You said fluoxetine.
Okay, that's all I could remember then.
Okay. All right, so you got your full 5 points. So go ahead and move your
1, 2, 3, 4, 5.
Okay, 5. So all the generic names were fluoxetine, sertraline, paroxetine, citalopram, escitalopram, fluvoxamine, vilazodone, and vortioxetine.
Okay. Thank you.
Mm-hmm. All right, so we can put this actually here so we don't lose
No,
that
it's your
one.
turn.
All right. So, get my topic.
Let me get the timer ready. Your topic is going to be the types of anxiety and related disorders, so you're just going to name them.
Okay.
You ready? Okay, go.
Okay. Generalized anxiety, PTSD, social anxiety, OCD,
Mm-hmm.
and social anxiety. Oh, panic attacks. Panic attacks?
Good job.
Did I get all of them?
Yep, you got all of them. So those were the 5 total. You can move yourself 5 points.
Okay. that game.
Picking my cards.
All right, so you're going to name for me the first line treatments for partial seizures.
Okay.
Okay. Ready, set, go.
Okay. Keppra, lamotrigine, oxcarbazepine, valproate, carbamazepine.
You said that one already.
I said oxcarbazepine.
Oh, okay. I think you're missing one more.
I don't know. I'm sorry.
Okay, you did say 5 of them though.
Oh, okay.
There was just a 6th one. So the 6th one was zonisamide.
Oh, okay.
I think you
forgot
say
that one.
Okay, so you got your 5 points. You can move 5.
Yay. Okay. Your turn. Okay. Pick your card. Your topic is going to be classes of drugs that you can use to treat Parkinson's disease.
Okay.
Ready? Go.
Okay, so carbidopa, levodopa is like in its own class of drugs. And then you have like your COMT inhibitors. You have your NMDA antagonists, anticholinergics.
You only have 5 seconds left.
Dopamine agonists.
All right, time's up.
Okay. Did I get it or no?
I think you got all 5.
Okay.
The total, these are all your options that you could have said. Carbidopa, levodopa,
Just had that one.
COMT inhibitors, direct dopamine agonists, NMDA antagonists, MAOB inhibitors, and your anticholinergic agents.
Okay, so I didn't say MAOB.
You missed one, but you got your 5 points. You can move.
Okay, go ahead and choose. All right, so this is going to be probable causes of seizures in a middle-aged patient. So this is age 35 to 60.
That's a hard one. I remember the chart.
Okay, try to think,
But
but I'm starting now. So you
Okay.
are tied up with me. Okay, ready, set, go.
Trauma,
Good.
vascular disease. You said middle-aged, right? Drug withdrawal.
Mhm.
I think alcohol withdrawal goes with that. And I can't remember anything else.
2, 1, okay. You got 4 of them, which is good. Okay, so you said trauma. The one that you forgot was neoplasm. And then there's vascular disease that you got, alcohol withdrawal, and then other drug withdrawal as well. So you got all of those.
So I'm moving 4. No, you're winning.
Not yet. I'm still behind you.
Okay. Okay. Choose your card.
Oh.
Thank you. Okay. First aid steps for generalized seizures. Now, I know there are a lot of options for this one, but as long as you can name 5, you can move your maximum total spots.
Okay.
You ready?
So generalized, right?
First aid steps for generalized.
Okay.
Ready? Go.
Okay, so you definitely want to offer help. You want to like loosen any tight clothing, which you wouldn't do for a partial. You want to lay them on their side.
Side.
Look for if they have any ID. And then would you oh my gosh, I'm under pressure. Can't do it.
Nope, last second. Oh, done.
Okay, so I got 4.
Okay.
Wow, there's so many choices.
Yeah. So I'll just go through them. It's cushion the head, remove the glasses, loosen tight clothing, turn them on their side, always need to time the seizure because then you are able to figure out
Oh,
which
that's
one.
so important. Yeah.
Mhm. Don't put anything in their mouth. Look for ID. Don't hold them down, and offer help, which is important. What you said. So good job. You only get to.
So we're tied. All right, we're halfway there.
So here you go.
Critical time. Okay. So you're going to have the cognitive symptoms of Alzheimer's disease. Okay. So let me get the timer.
Cognitive symptoms. Okay.
Okay, so ready, set, go.
Memory loss.
It's the obvious one. Keep
Mhm.
going.
Disorientation.
Mhm.
Impaired perception of time. Impaired executive functioning. And I know all those A ones.
You just need one.
Apraxia.
Praxia, yep. Did you get it in time? Wasn't looking at the timer.
Yes, I did.
Okay. All right, so you got 5. All right, so they were memory loss, aphasia, apraxia, agnosia, disorientation, impaired perception of time, and then impaired executive functioning.
Thank you.
Okay.
Okay. Your topic is going to be to list the symptoms of depression.
Okay.
Go.
Okay, so the first one's sleep. So you can have like an increase or a decrease in sleep, a decrease in interest, like anhedonia, like pleasurable activities and stuff, feelings of guilt. Your energy can change, so like lower energy. Appetite. Appetite can increase or decrease.
Yep, increase or decrease. Good job. You got your 5.
Oh, okay.
Just in time by 3 seconds. Okay, so I'm going to list all of them. It's going to be increase or decrease in sleep, loss of interest, increased guilt, decreased energy, decreased concentration, increase or decrease in appetite, psychomotor, and suicidal thoughts and ideations.
Yeah, Siggy Caps, I remember now.
Yep, I just remember Caballero teaching it.
Yeah.
Okay. My turn?
Mm-hmm. All right. So you're going to tell me the risk factors for anxiety-related disorders.
Okay.
Okay. Ready, set, go.
Okay. It's definitely genetic.
Okay.
Socioeconomic status. Stress. Women, I know he's stressed, have it more.
Women have more.
So gender.
Gender.
Mm-hmm. And family upbringing.
Right in the nick of time. Okay, so you got all 5. And that was all of them. Genetics, gender, socioeconomic status, recent stress, so unable to cope with that stress, and then family upbringing.
Okay.
Oh my gosh. Oh. Move it. I got all 5, I think.
Okay. Mm-hmm. Okay, pick your card. Okay, you're going to be doing the contraindications of phenobarbital.
Ooh, boy.
Right. Ready? Go.
Okay, so I think like renal insufficiency or like renal disease, and then hepatic also. You have to be careful with both of those. And then pulmonary disease. Something with a P.
That's also what's...
Porphyria. Porphyria.
3 seconds.
I don't know.
Done.
Okay.
You got 4. Okay, you were just missing history of hypnotic drug addiction.
History of what?
Hypnotic drug addiction. Mm-hmm.
Okay. So I got 4.
Mm-hmm.
1, 2, 3,
I'm almost at the finish line.
We both are head to head.
Okay.
Okay. So yours is adverse effects of valproic acid.
Okay.
All right. Ready, set, go.
Are there a lot of them? Okay. Tremor. PCOS, I remember, and I definitely remember the alopecia. Those scared me. And weight gain,
Mm-hmm.
headache,
Mm-hmm. You can keep going in 10 seconds just to test your knowledge.
GI,
Mm-hmm. GI what?
GI problem, GI upset.
Mm-hmm. Time. Okay. So you got most of them. You got 6, and there was 8. So it's but you only get 5.
I'm 1 away from finish line.
Okay. GI upset, headache, somnolence, tremor, weight gain, PCOS in females, alopecia, and blood dyscrasias.
I never remember the last one. Okay. Your turn.
Here we go.
Pick a
1,
topic.
2, 3, 4, 5.
No, you're missing a lot. Pick a topic. Okay.
Okay.
Your topic is going to be valproic acid drug interactions.
What is valproic acid?
It's very important.
Okay, I got this though.
Ready?
Go. All right, so it's going to be SSRIs,
Okay.
carbamazepine, phenytoin, aspirin,
Okay.
and warfarin,
Oh, you hit your 5. And the last one.
lamotrigine. Bang.
Good job. With 10 seconds to go, you got all of them.
1, 2, 3, 4, 5.
Okay. I need to get this last one before you. Okay.
This is so not fair. Okay, ready? So, you're going to tell me the DSM-4 axis components and what they are. So the number and then like what each one represents.
Okay.
Okay. 30 seconds on the clock. Ready?
Start?
Set, go.
Okay. I know axis 3 is the comorbidities.
Okay.
I know Caballero definitely asked axis 2 is the personality disorders.
Okay.
And he said axis 1 is the main psychiatric disorders.
Mm-hmm.
And
3,
axis
2,
5 was
1.
the
Out.
Okay. Yeah.
Okay, you got 3.
Well, I hit the finish line.
Good job. Good game.
Yay. Well, that's an example of
Brain burst.
Thank you.
I hope you enjoyed it. Bye.